let's see, 10. Perfect. All right, we are recording, and just from the jump, I will be sharing a recording of today's webinar shortly after we're finished. And so yeah, feel free to reference that in the future. But um, yeah, I expect this isn't news to folks, but fragmentation, the early childhood field is a very fragmented one, and that fragmentation stems from just a ton of different funding streams in the space, trickling from the federal level down, whether that's Head Start, Child Care and Development Fund, the Individuals with Disabilities Education Act, Part C and B, you have Medicaid, you have TANF, you have any number of other federal grant programs. You have states, many states support state-funded pre-K programs. They have others. Many localities have their own supplements. You have all these different funding streams in the space. And that fragmentation has had real impacts on early childhood data, the early childhood data ecosystem. But I think it's had very real direct impacts on data describing where, when, and how funding is allocated, the blending, grading, and layering of funding down to the child level. And perhaps most important, data describing what it actually costs to design, deliver, sustain high quality services to children, families, and communities. So we have the data quality campaign. We are all about using data as a flashlight, something that can illuminate where we stand, but also, how and where we can improve. But what if we don't have a flashlight, or the flashlight doesn't work, right? So there's a very real need for the field to have better data around cost and funding, not only to describe the state of the field, but I think to inform all sorts of decisions around designing systems, more coherent systems, allocating resources, and supporting providers with running sustainable businesses. So that is the focus of today's webinar: what is possible with better early childhood funding and cost data. So I am Charlie Rosemond. I'm an advisor of early childhood with the Data Quality Campaign, or DQC. So we are a national level policy and advocacy nonprofit focused on ensuring that people have the data they need, that they have actionable information for decision making. So we work across, we're all about better data across the P20W spectrum. So early childhood, K-12, higher education, and the workforce, ensuring folks have that information where and when they need it to make decisions and take action. And so I'm thrilled today to be moderating this panel with three experts. So I'll let each of them introduce themselves, a bit about their role, their work, how they use data, and then we will dive into really the bulk of today's webinar, a set of questions, just getting their thoughts and ideas around what's possible. Hi, Charlie Rose. I'm a data advocate. Like, what's possible with better data? I think that's the hope for today's webinar. And yeah, like I said, learning opportunity. Please feel free to throw questions in the Q&A box. We will look to answer those as we can. If not, we will try to hold time at the end for some of those questions. So please feel free to ask questions as you have them, and I'll try to weave them in as I can. But yeah, with that, we will go ahead and get started with Jeanna.
Thanks, Charlie, and thanks for having us. My name is Jeanna Capito, and I'm with Prenatal to Five Fiscal Strategies. I'm going to go ahead and do a little introduction to the whole organization, or are we going to do intros all the way around the?
We're splitting it, yeah, one by one. So go ahead, Jeanna.
Okay.
Personal, work, yeah.
Okay. I'll start with a little bit of introduction to the organization, which does also tie to sort of the reason for forming it. And I think a lot of folks have this, especially once you reach a certain point in the work that you do, you have this opportunity to do something or create something that really reflects what over the course of a career dedicated to babies and preschoolers, you find is sort of the biggest hole in the work that we're doing. So this idea of what we could do more with better data. I feel like we've spent a lot of time trying to work with the data we have and then kind of build solutions to use the data we have better, partly because some of the solutions or the ways in which we're currently operating, good or bad data, is still not meeting the needs of children and families and the communities that we're trying to serve. And so that's where we started with Prenatal to Five Fiscal Strategies. And that organization is focused on across the national on supporting both fiscal and governance structures at the state level, local community level, certainly the regional level. And as part of that, we really focus on then the system change that comes with it. We could have better data, we could have better answers to the question of what does it cost or how much money do we need. But if we don't also have a system that is equipped and prepared with capacity to respond to those answers, then we will frequently end up operating in the same way we have been operating because that's the sort of pattern of behavior that we've had for years. So new information and better information doesn't necessarily change our way of operating. I can talk more about prenatal to five fiscal strategies here in a little bit, but I'll turn it back to Charlie.
All right, so next we have Theresa. Go ahead.
Hi, so my name is Theresa Hawley, and I am the Executive Director of the Center for Early Learning Funding Equity. We go by the acronym CELFie. And we're a very similar organization to Prenatal Five Fiscal Strategies, same sort of origin story of wanting to bring together all we learned over a course of a career to come to bear on the issue that we see as being underappreciated as a lever for pushing a better system for us, which is how the funding is designed for supporting early care and education systems and services that kids and families need. So our business model at Selfie is a little unique. We do a whole lot of consultation with states and communities, helping them to think through their funding strategy and the design of the funding systems that they have. We also do a bunch of field building research. So we have a project called Shortchanged, which is looking at the total amount of money that's being spent on early care and education across federal and state sources across the country. So we do some of that kind of field building research. We do a lot of communication work. So really getting the story out there and helping people to better understand the economics of the early care and education industry and the challenges that it faces and the possibilities of new and interesting funding mechanisms and designs that we could use in order to push the field forward. And then lastly, we focus a lot on data because we are the home of the Chicago Early Childhood Integrated Data System called CSIDS, which is a project that brings together data from the Chicago Public Schools, all of the Head Start agencies, as well as the state funding streams that are going into early care and education, tries to bring all of that data together in one place to be able to track what is happening in the city of Chicago. So we know very intimately how hard it is to actually build the data that one needs to be able to support good work in early care and education funding design. It is very, very tricky. And Charlie, we kind of took that baton from you when you were here at NIU, trying to get all of that started. And Charlie and I go way back in our determined effort to make sure that we ever got an unduplicated count of the number of kids served in Illinois and the number of slots that there exist to even serve kids in Illinois. We really understand that these are hard things to solve. So what we do at Selfie on the next slide is our work is sort of organized around three big questions. The first of these questions is, what would the system that we need actually cost at scale? So that is kind of broken into a couple different questions under that. Who needs what? And then what do all those what's cost? How much do each of those kind of services cost to provide? All of that requires a whole lot of data to help us understand how to calculate that all out and know, these questions of who needs what kind of services and what they cost. Second big question that we focus a lot on is how much are we spending now? So that we do that at the national level and state levels with our short change project of tracking all the total amount of public funding. But we also do something that we call funding equity mapping, which is taking that data and connecting it to like the actual addresses where kids are served. Where is that money flowing? Because we know in an underfunded system, it's not just that the money is not enough, it's that the money's kind of lumpy where it is out there across the system. And some places are getting funded at a reasonable level of adequacy, where other places are getting really truly left behind. So we try to shine a light on that, and in terms of this, how much are we spending now? And then lastly, we focus on this question of what's the best design for dispersing the funding and allocating the funding. So how do we create better funding mechanisms to get the money out there? How do we address the issues like low compensation in the field or deserts where there's just not enough services? What about the way that public funding is designed is making the system behave the way it does now? So we look at that a lot. Again, all of these things are going to require us to have a whole lot of data about who's getting served now, how the money is flowing now, what it is that kids and families need and want, what that really costs. So data undergirds everything that we try to design and do, and all the consultation work that we do with the states and communities that we work with.
Awesome. Thank you, Theresa. And yeah, we do go way back, and Illinois is still working on it. A lot of states are, but yeah, it's definitely been a long-term effort. So with that, we will go to Alicia.
Okay. Again, thank you, Charlie. My name is Alicia Wilson-Ahlstrom, Vice President for Learning and Innovation at Children's Funding Project. You all will actually hear quite similar kinds of origin stories between our three organizations, and we all know each other well. And again, Children's Funding Project was founded by Elizabeth Gaines, who is our current CEO and founder. Again, you'll hear kind of some through lines in terms of origin stories and where we kind of touch this public financing space. Again, I have had a career-long interest and engagement in democratizing data and what that can do to really kind of support growth and development, capacity building in communities. So that's my little mini origin story in this larger one. But Children's Funding Project really was created to help communities close opportunity gaps for children and youth through strategic public financing. One of the ways in which I think we position ourselves is that we actually work cradle to career across the age span and the many different developmental spaces in which children, youth, and families live, work, and thrive. But we really work alongside communities to answer three questions, actually pretty similar, around how much are we currently investing in our children? What would it take to actually, what would it cost to actually fund our goals? And how do we close that gap? 2/3 of our work, we do that work in early childhood, and the other set of work we do across that age span that I had mentioned. But we really help communities to kind of answer those questions. We really help communities understand the data and policy tools available to them to address those questions. We work with communities to build capacity in those communities and develop tools to support strategies aligned with those questions. We elevate what's working across the country. What happens when we marry the best of what we have around data with good strategy? And we stay active in cheerleading and working alongside of communities in the broader movement for a more proactive approach to children's funding. Next slide. And let me have you go to, yeah, thanks, Charlie. So again, helping states and communities to select and build capacity to use strategic public financing tools obviously starts with data and a strong data infrastructure to support the choices and actions that those tools enable. A few ways that we really work with communities is we do fiscal maps to aggregate public funding for children and youth. organized around child outcomes rather than agency silos. So speaking to some of the fragmentation, really kind of changing that orientation around what we can make more visible. That's often invisible as people are at decision-making tables. We also do work around cost modeling to measure again what high quality services actually cost to deliver, accounting for the range of different costs that get baked into that. And we really are trying to name the gap between current rates and reality. We also maintain several funding databases and fiscal mapping tools that support our ability to just kind of track federal funding resources for children and youth, recognizing that, again, some of the fragmentation that we see kind of in local communities, also we see in the federal landscape as well. We have also, in our current landscape, been tracking also policy changes in real time and really just illuminating what's shifting, what's at risk, and where opportunities still exist or are shifting. And then lastly, I just want to lift up that we also demonstrate gaps between kind of current and true costs. And so we do tracking of not only kind of not only dashboards around kind of the gap, but also voter-approved children's funds where communities tax themselves to address gaps. And we really try to turn that data into opportunities for shared ask that brings funders and policymakers to the same table. We recognize that a community might move through several of those questions and tools at different points in time. A fiscal map to understand current investment, cost analysis, and modeling to understand what full funding would require, and a sourcing dashboard to mobilize around the gap, and that those tools are designed to be sequenced and not siloed. And then the last thing I'll say is that the act of doing this work is very much relationship driven in connecting kind of state agencies, providers, budget offices, and advocates around a shared picture, and sometimes for the first time. I'm going to actually kind of stop here. We'll come back to this slide in the context of comments that will go and moving forward with the panel.
Perfect. All right, Alicia. And on that point, so Jeanna wanted to kick it back to you quickly to say a bit more about what people are doing at Five Fiscal Strategies.
Thanks, Charlie.
And so, yeah,
Yeah, so I just wanted to jump in a little bit on some of how, as an organization, data is utilized under the current work. And as Dr. Hawley and Alicia have both stated, there's certainly some overlap in the types of work that we do and then the places that we may be working, which is why we do try to make sure that we're working in strong partnership and really thinking about building the field as well in these areas. So this is a great example of like what sort of data do we all need, and we're trying to mine and utilize as a key piece. So I just focused in on the fiscal mapping component and cost modeling component of the fiscal strategies that Prenatal to Five Fiscal Strategies does to draw out some of the particular data points that we may be looking for. And some of what sometimes is a surprise to folks especially when we start engaging in the fiscal mapping, is how much of the data that we may be trying to unpack is qualitative. There's certainly there's this key amount of quantitative data that comes with a fiscal map, but the pain points that may be occurring around how much money or whether the dollars that are coming in are actually being utilized for the population that most needs it, or if it's enough funding, many of those questions are actually in the qualitative answers. So some of the examples of those things are really sort of understanding who's eligible for the funding, the population that the funding's trying to reach, understanding some of the ideas of length of eligibility and the processes for administering the funding, really unpacking that connection between what the funding is intended for, the contracting process, and then the reality of how that plays out on the ground in communities. Right now, we're working really closely with a lot of home visiting work where there is a significant disconnect between a funding stream in a state and the limitations of who can be served with that funding stream and the dozens or triple probably more families that need the home visiting than can be served by that funding stream. And when communities are making the choice to only use that one funding stream, they are immediately limiting the families that can be enrolled and the types of providers that can serve them. And so it has a pretty significant ripple out to operational choice points. And it's not just an answer to how much money. On paper, it might look like a good amount of money for the service, but the disconnect between the reality of implementation. So that's a key piece of the fiscal mapping exercise, that we're trying to do that analysis and kind of think about that characteristics of the funding stream, going that level deeper, and then think about some of those system responses. So supporting those communities in that particular state I was just mentioning, and really being strategic about how they leverage that funding stream in partnership with other funding streams, so they don't end up only serving one type of family and one type of provider serving them. And then on to the cost modeling when it comes to data. We do cost modeling at multiple different levels within the system, starting with the direct services and really seeking to understand the cost of the direct services that are delivered to children and families. That includes childcare, early intervention, home visiting, family support services. And then we also build system cost modeling tools. And what I wanted to share around data from these tools, and sort of like that idea of considerations of data we need as a field and how maybe that data, can be improved, is the interplay among these things. That it becomes really important when we have an output from a direct service cost model, that we have data around the population need for that service, because to come up with a big number for how much the investment needs to be compared to the current revenue that we're seeing on our fiscal map, it relies on that understanding of the population, those you're trying to serve that are the best fit for the service, how many children and families are in that population. And that's often, that granularity is where at times the interplay of these two things, we end up with estimates of big numbers that probably aren't horribly far off, but it's really hard when you try to unpack speaking to exactly where that number was built if you don't have some of those data pieces that then basically you're sort of multiplying by each other to say, take the direct service cost, take the number of families trying to serve, and put it together to be able to understand what the total investment needs to be versus sort of an estimate of the total investment. And we find that there's a lot of scrutiny on states and communities when they're trying to talk about that big number that they need. And so the more that they can unpack the inputs and outputs that they're getting from a cost modeling tool and be really granular about it, is kind of a key piece of it. So some of these then are also supporting how they use, of course, their funding stream. So they're not just asking for more money from, say, a general fund or a local public source, but it's also to be able to speak to how they leverage their federal dollars and maximize what's coming into their state or community to the best of their ability to layer and balance. So thank you for that opportunity to talk a little bit more about our activities as well.
Of course, that's why we're here. And so, yeah, we are going to dive into questions. Again, please throw your own questions into the Q&A, try to work them in. If not, we'll hold them for the end of today's webinar. But yeah, I mentioned fragmentation at the start, data as a flashlight. Where do we stand? I think it's kind of incumbent upon us to start there. So, Alicia, wanted to start with you. How has, frankly, the inadequate state of data in this space around cost, around funding, how has that inadequate state affected the field? And, I know you and CFP are thinking about this a lot.
Yeah. So thank you for that question. So the state of funding data has a structural consequence that goes beyond information gaps. So I think that's the first thing that I want to lift up. And it's not just that data might be hard to find or to access, but that its absence has downstream effects like underfunding persisting without a level of visibility for all actors to act on it, for example. And so when we can't see kind of the whole of how much is actually flowing or what services actually cost, then we can't adequately address some of those downstream decision points that also need to happen. We can't address quality delivery in the way that that requires. We might have subsidization that gets normalized or undercounted because we don't quite have the right kind of data to look at that. Legislators or agency administrators don't have a clear picture of what the state is spending on kids. And that becomes a governance issue with data at the root of that issue. So that's the first thing that I might say. The governance dimension also matters for states that have invested in some kind of infrastructure to actually see and use fiscal data. Those are the ones that are poised to make the biggest moves in early childhood investment. So a children's cabinet that can ask where is the current data and get a real answer is in a fundamentally different governance position than one that can't nimbly do that. So those are some of the initial ways in which I think that that data picture has affected the field. So I'll stop there and I'm happy to go back and forth as we go on.
Yeah, Theresa, would love your thoughts next.
Sure. I think that I completely echo what you're saying, Alicia. That when you don't have this data, that people are kind of making up their own stories of how the system is working, and so I alluded to the quest that we've been on in Illinois here to just even know what the unduplicated count of kids who are actually served and the unduplicated count of slots that exist for kids to be served in the state is. And it really does matter, because if you want to try to fill deserts that are out there in terms of places where kids are not getting served, if you don't have the right data about how many children live there, and the right data about how many kids are currently being served or how many slots there are, and you have duplicated counts of things because you have multiple funding streams serving the same kids, and you don't have any way to say, yeah, but there's really only 80 slots in this community, even though we think that on paper it looks like maybe there's 160 because those 80 slots are all funded by two different funding streams. That lack of integrated data really it leads to a thinking about the system by funding streams, one funding stream at a time, instead of looking at it from the perspective of the kids and families who are being served and the providers who are doing the serving. So matters a ton for how we design the system.
Absolutely. Jeanna, anything to add?
The funding begins driving the services instead of what families need driving the services. So completely agree. I would take us down a path a little bit more on the inadequacy of data around cost and some of the what we frequently use the concept of, unintended consequences, but certainly once we understand that what consequence is being driven by an approach, we have to begin to reflect on whether it remains unintended if we continue to sort of reinforce it as a part of our system. And the lack of data on cost has really played out, especially if we just think about childcare services, it's played out in some misunderstanding. There's many instances where you hear folks talk about tuition or the market rate as the equivalent of the cost of the service. And that becomes sort of the education that folks have received or what they hold as their understanding of the cost of childcare. And so then if you were to actually talk to them about the idea that the market rate is the tuition that is charged of families, in a perfect world, this would be the full cost of the service. It has been many years, if it ever was, the full cost of the service that a provider was able to charge a family, especially in many communities. The disparity between what a family can pay and how much it costs to deliver the service is pretty big. If for years you've believed that the information that you have from something like the market rate and the tuition is equivalent of the cost, we have to do like re-education. We have to go back and sort of pull in data, and it becomes a much steeper hill to climb, because now we have to build up some measure of trust in the information that we're sharing, because the individuals like legislative staffers and elected officials are holding this idea that everything I knew or thought I knew about what childcare cost, you're telling me it's not that. And now I have to, and the number you're telling me that is the cost is way higher, right? So it's very hard to re-educate someone from that vantage point. And so that lack of data of cost has had, that's one significant ripple, right? And then it's also in that incorrect belief that tuition is covering the full cost of services, and then understanding that tuition is also in many of our states still the solo driver for the publicly funded subsidy that covers the cost of care, is another place that lack of cost data is leaving us with an incomplete picture and driving decisions that are unfortunately disadvantaging providers and families because the voucher with a publicly funded childcare dot voucher is what families have to go out and sort of purchase their childcare from a provider. And if that voucher is not equivalent of the cost of the service, the families have a portion of what they actually need to purchase, not the full subsidy. And families working knowledge of that, providers working knowledge sort of where all that came from is coming from that lack of good, strong data on cost and putting together cost data and market rate data to sort of understand the market and understand tuition, but ensure that we are not disconnected from the cost of service. And so that data inadequacy has left us, quite a hole to dig out of, from the re-education all the way through to then thinking about the system changes that need to be made and the processes that we use as a childcare system to set public subsidy rates, and how we need to rebuild some of those and scaffold on more cost information. And it's a long haul. When you've done something for more than 2 decades one way, it takes a lot to shift how that work gets done.
Absolutely. So, true to form, like I said, I'll try to weave in these Q&As. So, we just got a question from Tim. Thanks for the question, Tim. So, I'll just open this to the floor. So, how do you capture data slash information on middle income families that are struggling to afford childcare? Like recognizing that this isn't necessarily just an issue for low income families. And Theresa, that's how you just came up.
I mean, this is a huge, huge issue, because a lot of times the data that we are working off of is billing data, it's administrative data that has been collected and for the purpose of public funding streams. A lot of middle class families aren't eligible for those funding streams. And so there isn't anywhere that we're necessarily collecting data about the kids who are being served in private for-profit settings. Often when you're building out a whole system and trying to understand how you support quality and access to quality for all kids, this is a big hole that we often have. As hard as it is to figure out this sort of unduplicated count of kids who are served with public funding streams, it's even harder to understand the number of kids who are served in the private marketplace, because there's no particular reason for anybody to report that out and for that data to get collected. So a lot of times what you end up doing is building estimates off of what data you can find in the ecosystem. Things like license capacity, what are people reporting as how full they are, et cetera.
So we will keep it moving. And I again really appreciate the questions. We will get to them in due time. But yeah, keeping it with you, Theresa. So you you made it explicit, a lot of the challenges that we face here in Illinois, but you'll continue to face at Selfie. So I'd love to hear maybe a bit more about those specific organizational challenges around accessing and using data for your work.
Sure. I would say the number one challenge that we face when we're trying to do some cost modeling, or we're trying to do system finance design work in partnership with our states and communities, is that the data that we need was never collected in the first place. So it's kind of building on this idea that the kids that are served by private providers with private tuition, it's really hard to get data on that. But there's a lot of other things that many states don't actually collect data on, or the data that they collect, they're collecting it for a purpose that doesn't lend people to fill it out very correctly. So things like staff qualifications, what really are the qualifications of people who are working in programs out there, that matters a lot for when you're saying what is the true cost of care, like what kind of salaries those people need to be making is related to what the qualifications they have. Many states do not have that data, and certainly do not have it down to the level of detail that one would want to have it to be able to draw upon for building out a good cost model. Even the number of staff that a childcare program has, a lot of times we're going from here's your licensing standards, and we're going to say that you're going to meet those licensing standards, but it'd be great to know how many people you really do staff your program with, so that we can make sure that whatever we're costing out as the cost of care relates to what you're actually doing out in the field, not just theoretically what we think you would be doing. What kind of wages are people currently making? Because a lot of times we're trying to help people think out a strategy for filling a funding gap for what the tuitions and existing funding students support now versus what a well-funded system that was able to pay competitive salaries to attract and retain teachers would pay. Kind of have to know what people are making now in order to understand what that delta is. So there, a lot of times that data isn't actually collected. And as I said, the data that is collected for a specific purpose and maybe doesn't get updated all that often. And so we can't really rely on it. You're going and looking at it and everyone's like, yeah, but I don't think that's really what's happening out there now. So you end up having to do a lot of original data collection when it comes time to do that cost modeling. Lots more too about this, the side of the question of who needs what. A lot of that data is not collected either, or it's just part of a census data that isn't granular enough. You can't break it down to enough to the local level to be able to inform the funding strategies that you need to do. And sometimes, that data is either out of date, or you're worried that, like, for reasons that people not wanting to participate in the census for good reason at all, that it may not be as accurate as you need it to be. So many challenges, I think, that come from either the data wasn't collected in the first place, or was collected in a way and for a purpose that leaves it not granular enough or accurate or timely enough to be useful for the purposes we have at hand.
That's right. That's right. Like it's so funny. This, like, folks are inundated by data. The field has a ton of data, but it's not always the right data. Never mind, like, turned into actual, like, useful information for folks, which is a whole different thing. But yeah, so I'll just open it up. Gina, Alicia, any, like, challenge it, recognizing the overlap across your
Mhm.
organizations in terms of this work and kind of
Mhm.
the focus, like, anything to add on challenges?
Yeah, and maybe one thing that I might add is, again, I agree very much with Teresa. I think that the challenge is really largely structural, and it really comes up really around there being sometimes too little shared infrastructure to collect data and to share that fiscal data consistently. There have been efforts to kind of have states kind of have some of that collective uh, data system together, and but that takes a lot to maintain over time. And in kind of the maintenance of that, there can be kind of institutional memory that gets lost and data quality degrades. So that's just kind of been a persistent challenge. Sometimes also just the whole idea that even within kind of one system or an agency, like not all the data is in the same place. And so there's pieces over here, there's a piece that's kind of getting lost to institutional memory, there's this piece over here, and sometimes it can be hard for a single entity to fully make sense of its own data. In one of the states that we worked with them to kind of just really just do some of that pulling together from the different pieces of cost data around to really kind of organize it, produce policy options now that they could see the full picture about this costs this. If you bundle it this way, here's what that would cost. But really, I just want to lift up just kind of the challenge and just appreciate that some of the most basic ways that we think about kind of bringing data together. We're still kind of building kind of infrastructure and resources just to do that well, and just to kind of recognize that people are operating and doing tremendous work, and sometimes without all of that infrastructure that it takes to maintain those systems.
That's right. That's right. Yeah, for the sake of time, we'll keep it moving, but we'll start with you, Gina, for the next question. So, like, what's possible? Like, what opportunities exist? And it's just came up just now for Alicia. Like, what opportunities exist for changing policies or systems towards better data use in this cost and funding realm? So, starting with you, Gina.
If you don't mind, I'd also want to do a little bit of weaving in some of what Morgan's put in the
Please.
Q&A, because I think one of the the question on sort of how Head Start, for instance, can be more responsive to this concept of cost and maybe be somewhat of a leader as part of the system is also an opportunity. And I do think there's been some movement in this direction. Having started in Head Start about 25 years ago, there was a feeling of you submitted grant applications that showed the lowest possible cost per child because then you got funded, and you got funded for and what you were trying to do was, especially in the world of early Head Start in those very early days, just get the money because no one had early Head Start and you desperately needed it. And moving away from that mindset of that, what that then puts us in a position of is nonprofits are then layering on other private funding because they didn't get enough funding from their federal grant because they were trying to be competitive with their federal grant. And sort of breaking that cycle of that, yes, while there are limitations on the amount of funding in our funding sources, we have to be honest about what the service costs to deliver so that we are allowing for programs to have the capacity to deliver the quality service, to collect and manage the data that they're getting, because the types of things we're talking about are a heavy lift. And if you don't have if administrative staff spend half of their day in the classroom because you don't have enough funding for the classroom staff, because your cost per child that you put forward was an undervaluing in order to try and win a contract, then you can't do good work on data. And it becomes very hard to make the case for how here's the families we serve, here's the services that we need to meet the needs of those families, and here's what that looks like in practice as data points, like analysis of those data points. It becomes just totally overwhelming, right? Everything is too much and all done generally outside of that individual's workday. So I think that the opportunity is sort of acknowledging that we need clear answers to questions like the cost of service, and we need to all own that the cost of services are typically greater than the funding streams. Head Start has made some movement to when you do a reapplication, you adjust the number of slots. And there was a point in time where there was sort of that feeling of you'd never come back with less slots than what your previous 5-year application was because you'd be, laughed out of the choice pool. But instead saying, no, if we compensate workforce where we need to, this is our cost of service, and this is the number of children now that we can serve, and it is lower than what you originally gave us. It's not that we want to serve less children. No one wants to serve less children, but if we're serving those children on the backs of the workforce, and we also are basically making it completely untenable, no one else can maintain this program the way it's currently the house of cards that we've structured it, then we are not building something that is sustainable or is for the future. So I think some of that honesty is a key opportunity, and then following it through with the systems to support so that the decision making takes into consideration what the cost is compared to the number of slots and allows for that choice and allows for it not to be just take the lowest dollar amount and that's the one we'll fund sort of decision making. And I think that's an opportunity, and we've seen some movement in that direction. And more entities like Head Start as a funding stream, I think, can continue to be a leader in showing that's a value that they hold in their grant making.
Awesome. Thanks, Jeanna, and thank you for weaving in the Q&A. I really appreciate it. Theresa, would love to hear from you next in terms of these opportunities for change.
Sure. I do think that there, with the big data, and the data analysis techniques that are out there and existing now, there are opportunities to better mine administrative data that we have, especially across different agencies. So when we get to these questions of like, how many kids are there in a community that need preschool education, or how many children are there that are low income and working families, there are multiple data sets out there that could be mined and pulled together to start to answer these kind of questions. We don't have to just rely on American Community Survey to be able to give us the answers to those questions. That's going to take some investment, some real work. So, with some partners at NORC, we put out a brief a few weeks ago on this idea of small area estimation. And how can we use techniques that have been built up in other fields to think about getting deeper into the question of how many families are working full-time, how many are working part-time, how many might be able to benefit from a part-day program, or are going to need the full-day year-round program, or are going to need odd-hour care. Like this is going to require multiple different sources of data being brought together and being brought to bear on the questions that the early childhood field has.
Absolutely. And I will put in another plug for those resources, those Selfie, NORC, CSIDs. those resources created in partnership here in Illinois and Chicago. They're awesome. Check them out. I'll try to include them in the follow-up to this webinar, but thanks, Theresa. Alicia, I know you're really interested in this question, like opportunities for change. How are you and CFP thinking about this?
Yeah, so I'll just kind of plus one everything that was said before, and I'll just add maybe a little bit bigger picture opportunity. So I think one of the biggest opportunities just might be continuing to kind of work on hearts and minds for a mindset shift around treating fiscal data infrastructure as a longstanding public investment, and one that the field owns and builds on, and not just as a project by project deliverable that happens in a certain place, time, state, etc., but to really kind of continue to just kind of work on the mindset that this is really a long-lasting public investment project to really do this kind of work, and that the opportunity can be really self-sustaining, to think about this as kind of shared infrastructure that any state or community can build from rather than starting from scratch, and again kind of a place by place, scenario by scenario, kind of situation. So I think, I'll stay in that kind of lofty, what the dream would be to work for, just to kind of add to some of what was more granularly added before.
All right, thank you. So lofty, pie in the sky, what's possible? Thinking more practically. I mean, you could go ta like as tactical as you want, but like what are and I'll post this to the group. Feel free to jump in, but like, what are your recommendations for the field to pursue some of the opportunities that you mentioned and help meet this persistent need for better data around cost and funding? So I'll open that up.
Well, one very concrete recommendation is never give anybody money without asking them for the data that you need. So when you're designing a funding stream, especially a new funding initiative, like for example, a lot of folks, when we had the COVID resources, we were putting out there the new stabilization grants that we're putting out to programs. Many states took advantage of that opportunity to ask questions of providers that they'd never asked before. How fully enrolled are you? How many classrooms do you have? How many teachers do you have? The data that they knew that they needed for their system design, they took advantage of that opportunity to ask the questions. And don't give money unless you ask for data.
Perfect. Alicia, Jeanna,
Mm.
anything to add, like recommendations from the field?
I would add to expand our collective view of the funding landscape and the kinds of things that we are collecting. So, for example, we are collecting data on voter-approved children's funds, and those as just kind of real options that are part of this funding landscape, and understanding how those particular funds kind of weave into, what currently exists uh, in the fabric of this whole kind of fiscal data landscape. We know some things about what they fund. We're gathering information about how they're governed, what they cost to administer, how they interact with other public streams. And so I think one of the opportunities is to, continue to kind of, again, expand kind of the landscape of the kinds of things that we are tracking, that make for that total fiscal landscape.
I would just add, and probably going back to Teresa's response, is the ask for the don't fund without asking for the data that you need, but then also being really careful about what it is that you need and acknowledging if there's a possibility that an existing source gives you enough of insight into the population or that big concept of how many families there are to serve, then at the program level, especially when it comes to the potential sort of invasive and family burden that can come with additional data collection, how is there another way to get there, or is there a way that we can really streamline what we're asking so we're not making more burden for programs and certainly things that could end up feeling invasive to children and families. And that's a hard one, right? Because it takes like being able to really think more strategically about all the data that it may be available, what need it can fill, what it doesn't, and then laying out a plan for the data that you're going to then collect with a new opportunity, like funding something and asking for more data. So it takes what we often don't have is time and really, sort of intentional approach to the work. Instead, we're sort of, this might be the only time we get to ask for more data, throw everything on the list, and that's where we then burden out programs. So I think that the more strategic we can be in our thinking and thoughtful, that will help us with getting the best out of the data too.
Got it. So one final question for the panel, then we'll shift some of the questions in the Q&A. But briefly, why does having better cost and funding data matter right now, like in this moment, just given kind of the state of the world, the state of government at the federal level or across states? Like, why does having better data matter now? And Alicia, I know you created a slide for this earlier, so I'd love to start with you. Like, why now? Why do we need better data?
Yeah, sure. So early childhood leaders are being asked to make consequential decisions about what to sustain, what to fight for, where the field's best resource options lie at a moment of extraordinary fiscal uncertainty. So I think that's really my opening salvo and kind of why now. And there are a couple things to think about. One, I think, is it's important to defend and align what we already have. There are areas where the funding landscape is shifting faster than most states and communities can track. And it's just hard to defend what you can't describe. And many communities have never had a complete picture of what they were working with to begin with. So I think the first why now is about defending and aligning what we already have. I think the second is really to inform emerging and creative strategies with more fiscal clarity. So again, the example of voter-approved children's funds, dedicated local revenue streams, blended braiding financing. These strategies require a level of fiscal clarity that the field has not always historically had. And it helps us get clear on what's already at the table, what each dollar can and can't do, and where real gaps are. So I think that's the other like why now. And then at the last, I go back to just kind of protecting the data record in an arena and era where folks can kind of both feel and can maybe see some shifts in like what's available vis-a-vis data at the federal level, other levels, and wanting to get a handle on that. And then also just to support and be a cheerleader for democratizing data for communities so that they can actually I think that's just a really important investment right now is to continue to just hold up the value of democratizing data that's rapid, that's reliable, that is contextualized, and we now have some faster ways and can put that in forms that non-specialists who don't wake up every day thinking about this can actually use. So those are the things that I would lift up as the why now.
Thank you. Theresa, why now?
So I do think we're seeing a lot of questions around that, like, do we really need to have standards for how many children are in the classroom or what the qualifications of staff need to be? And maybe it's all these regulations that are making the field cost so much money and pricing childcare out of the reach of families. I think having the data to be able to build the models and demonstrate like this is really what's happening about why things cost as much as they do is critical to bash these myths that somehow there is this magic way to do all of this so much cheaper than the way the field has been doing it up till now, and that we can wish away the fundamental economics of the early care and education industry. Having that data helps push back against that narrative.
Perfect. And Jeanna, close this out. Why now?
Yeah, somewhat along those lines for sure. Is this idea that we are we are constantly making prioritization choices. We have limitations on what we can do with funding. We need to have good information that allows us to inform those sorts of decision points versus just it's sort of the loudest voice gets funded or the we can't cut that because sort of really have it be data informed to make those sorts of decisions, but also because we are attempting to meet the needs of the workforce more and more with compensation because of the reality of the shift in our workforce. The workforce that is retiring, that is aging out of working in childcare in particular, is not being replaced by the same folks that it maybe would have been. Those individuals 35 years ago are not the ones that are coming into the field. And we know that because it is a high quality service that's being delivered, that we need to follow that with the compensation. We need to have the answer to that compensation and the cost of that compensation as we're making those prioritization decisions, because we are in many places have the dearth of workforce is a huge issue for the capacity or the supply of childcare for children and families. And so there sort of won't be a service to be talking about if we don't have a workforce to deliver it. There's no replacement for the workforce in these services.
Right. That's right. So yeah, shifting quickly to the Q&A. And again, as is always the case, not sure we'll get to all of these, but I'll try to group them. So, and I'll jump in on like there are a couple related to data systems. Yes, I think hopefully a takeaway from today's conversation, there is a real need to better integrate data, ideally systematizing that integration across these different funding streams and programs, because like otherwise, decision makers just aren't going to be equipped with the information they need to think about things across the entire system, just like from a design standpoint, but like allocating resources. So creating a unique identifier, like Theresa brought up, unduplicate, whatever you want to call it, unduplicate count, distinct, having some way to integrate at the child level across these programs to understand overlap, understand like which kids and families are being served by multiple programs, enables practitioners to better serve them. But from a resource allocate, like we live in a world of scarcity, like understanding that overlap is pivotal. And you're not able to do that without some way to actually integrate data on a technical level. So those IDs really facilitate that. Not news to anyone, I don't think, but like funding for this like early childhood data infrastructure is sporadic. A lot of states have relied on federal grants, which come and go, and they leave gaps over time. So I would say you see, I think two things. Those states that have devoted state dollars to this work and really prioritized it, like from the governor's office down, they are leading. And I'll find some resources to share in the follow-up. So I think that's the first, like state funding is key. But yeah, I think the next is, let me go back to the question. Just like understanding where there are funding gaps, like how philanthropy and other sources can help fill them. And yeah, just like I'll highlight South Carolina as a great example of like a state that has devoted state resources, but also I think maybe the second point I was trying to make, speed, like delivering value with relative speed. So like understanding a question, trying to answer that question quickly. So South Carolina has built the First Five portal, which is built on integrated data across services, state services, to try to facilitate families finding and accessing care across those services. So yeah, I'll share more resources after the fact, but appreciate those questions. And yeah, try to get to one last one. Are there, just posed to the group, are there data point like regarding voter approved childcare funds systems? Are there data or types of data that could be shared with voters that could support this work? I'll just open that up to the group. More of kind of an advocacy, like messaging, like how can we make the case?
Oh, We've been working on this for so long, right? And creating so many different kind of tools and ways of putting this in front of folks. I mean, I will say, like, with our short change project, we've created sheets for every state that lays out this is how much is being spent in that state on early care and education compared to what's being spent in the K-12 years. So I think that there, as much as there requires an infrastructure that is putting the data together and doing the analysis, there's a whole infrastructure of translating that data to voter messaging, to getting the word out about the need and what all of that means. So this is where the complementary organizations across our whole ecosystem are important, and why, even like the three of us work together so closely to be able to make sure that we get messaging out to folks around the need for more resources in early care and education.
Mm-hmm.
Great. So I see we're at the hour. I really appreciate our panelists today. Thanks to the three of you for joining. Thanks for your work broadly. Holly, y'all still with us. Really appreciate you joining today. Appreciate the questions. And yeah, like I said, I will be following up with a recording as well as contact info for our three panelists and various resources that have come up today. So again, want to thank Jeanna, Theresa, and Alicia for joining today. Thanks for attending, and please stay tuned for more DQC early childhood webinars in the future. Thank you and take good care.
Thanks.